Tex-TRAC is the Texas Teleforensic Remote Assistance Center. It is our telehealth program that we are developing with grant funding and state funding in order to provide medical forensic exams for sexual assault to rural and underserved areas remotely. And the Tex-TRAC program, it falls underneath our outreach arm of the Center of Excellence in Forensic Nursing. We are funded through an OVC grant, or an Office of Victims of Crime grant, and a contract through the Office of the Texas Attorney General. We have 3 pilot sites that we will be bringing up and providing medical forensic examinations in those rural and underserved areas. A SANE is a forensic nurse or a sexual assault nurse examiner who is an expert in providing the medical forensic examination for sexual assault. This nurse will be consulting through technology and basically remoting in to the exam room, so they will be on a monitor and they will be there to assist the nurse who is performing that examination and collecting evidence and providing care to the sexual assault patient. They will also be there as a resource for the sexual assault patient to be able to answer any questions that they might have also. This program really does support the rural and underserved areas. Sexual assault patients often will drive several hours, or it could even be hundreds of miles, to a big city, a larger city, where there is an established sexual assault nurse examiner program at a hospital. This program keeps the patient in their community and allows the forensic nurse of the SANE to remote in and help provide that care. So it reduces the trauma that the patient will experience just from the entire transfer process. And it also increases their comfort level. This program is perfect because Texas A&M University, the College of Nursing, and the Center of Excellence all have so many resources that we're able to leverage. We have a bioengineering department who's helping us create a unique piece of telehealth equipment that no one else has. And it's going to allow us to photograph and to get really close to injuries, to be able to document those injuries. We're creating unique software so that we can assist the nurse on the end who is being helped by the expert sexual assault nurse examiner to document and to really identify injuries and to make sure that their documentation is as thorough as possible. I've been practicing as a forensic nurse for 27 years and have had that honor to work with many vulnerable populations and individuals, and I'm just so excited that we're able to bring this to rural and underserved areas. I'm so excited that through the college and through the university that we have the resources that we can do this, because we're increasing access to care, we're improving care. Honestly, I wish I would have had access to a tele-nurse, a teleforensic nurse, when I was a new sexual assault nurse examiner, new forensic nurse, because I know how they feel. Those feelings of, anxiety, of stress. Am I going to say the wrong thing? Will I do the wrong thing? Will I mess up the evidence that I'm trying to collect? And having that expert in the room just to say, yes, you did a great job, or yes, you collected this the right way, would have been so helpful for me. And I know that we're going to be able to bring that comfort and reduce the anxiety for the nurses that we are going to work with down in South Texas and in rural and underserved areas throughout the state of Texas.